All right, so welcome to the beginning of week 6, and this week we're going to be talking a lot about reproduction and breeding your animals. And this is, as I've said this before, this is kind of my area of expertise, my area of research, and I really focus on, mare research more so than the males, but there is a lot of male research ongoing in my lab. We're actually doing some with a lot of different collaborators. So it is an area of research that we're looking at. We're trying to improve fertility in these animals, and I always get really excited about it because it's just so fascinating. Just the miracle of life is it's just awesome. So anyways, we're going to start with the female reproduction and female anatomy, and it's really important to pay attention to the female because a lot of our breeding decisions that we do in day-to-day management surrounds the female. We really have to manage these mares or jennies if you're doing donkeys to ensure that we can get them pregnant and successfully get a foal, because that's our ultimate goal is the offspring. And I'll tell you, working in reproduction, foaling season is the best. I mean, it's just when these little foals are born, it's the miracle of life. You see them come out of their moms, and it's just amazing, this process. So we'll get into that this week and talk about how doing that. So those were, we're going to kind of cover some of the reproductive tract and the different organs. And then here's a lateral view, so you get kind of an idea of how that is sitting in your mare or your jenny. Now I'll refer to mares most of the week, but a lot of this obviously can be applied to the donkeys. And where there are differences, I'll definitely let you know and make notes during the lectures. So looking at mare anatomy, we'll kind of start from the outside going in, and it's very, very, like I said, it's very, very important that you pay attention to what's going on in their reproductive tract, and there's different ways we can do that. So the first thing we always want to do is look under the tail, and you really should pay attention to what we call the conformation of the animal, of the mare, or perineal conformation. And that's really looking at her vulva on the exterior, because that definitely has an effect on her reproductive ability. As these animals age, or even some are just innately born with this, they have what we call pore conformation. So in this image on the right, this is what we call pore conformation, and you can see her anus, we call that a sunken anus, where it actually sinks in. Now with repetitive pregnancy, some of those ligaments stretch, some of that pulls down, so you might see this in aged mares too. But optimally, the image on the left is really what you want to see with your mares, because the problem is, with the sunken anus or this uneven vulva, or with the tilt, you start to run into some problems where they can actually, if you can imagine, as these animals defecate, some feces can actually build up there, and then it can actually get into the vagina. And then if it gets into the uterus, you start to have problems, which is called endometritis. You get some diseases of the uterine lining, which we're going to talk about in this lecture. So this is why it's so important to look at her conformation, and you can read there, they also could have trouble, urinating, and they also do this thing called pneumovagina, where they can actually suck in air into the vagina, and then again bringing in contaminants, which can contaminate the reproductive tract, which can lead to problems, especially with breeding. So there's this thing called a Caslix procedure that you may have heard of before or are not aware, but it's actually where we suture 2/3 of the vulva closed. And that's to prevent contamination getting into that uterus, especially during pregnancy. That you want it to keep contaminants out of there, to protect that embryo and then that fetus from any things like placentitis that can erupt from any of those contaminants coming in. So there's endometritis. You can see the definition there. So that's really one of the major problems that we see with infertility in mares. Their uteruses get contaminated, and then they have uterine infections and can lead to problems. So a Caslix procedure, is something that can help prevent that. And in the donkeys, the jennies tend to not need this as much. They don't have as much trouble with their conformation as mares do. So as I've said, you suture the 2/3 part of the vulva, but you want to make sure that bottom third is open, because she has to still urinate. So you want to make sure there's an opening there to do that. And then you definitely want to make sure this is removed at least 3 weeks prior to foaling, because that foal needs to come through that birth canal. So you don't want any barriers there, that could cause her problems. Now moving into the reproductive tract of the mare, you go into the vagina and it's really just this chamber surrounding the cervix. And really the only thing to note, especially with management, is any maiden mares or mares that haven't been bred before or maybe not exercised rigorously, they may still have the hymen present. So when you go in to breed her, or if you're going to do, either you physically, which we're going to talk about in a later lecture, through artificial insemination, or if the stallion's going to breed her or the jack's going to breed her for the first time, just be aware of that, that's going to have to be broken. Might cause a little bit of bleeding, but it's nothing too traumatic in my experience, breeding mares with the hymen intact. Now, that next barrier to that external environment, we went from the vulva and then, that vestibule that's in the vagina, and then the cervix is really your major barrier to the environment, to the uterus, because the uterus which is supposed to house the fetus, and it needs to be, really good environment for that to happen. So the cervix in the mare and the jenny, it's muscular. Is a little bit different than some livestock species that may have cervical rings. So you can see in this image here, this is actually a cervix of a mare, and this mare looks to be in heat. So this image on the left, so when the mare's in what we call estrus, which we're going to cover in a later cycle or in a later lecture, but during her breeding cycle, when she's in estrus, this is when she wants to breed to the stallion or the jack, and her cervix is open. So it allows, spermatozoa to get in there, to get into the uterus, up into the horns and the oviducts to fertilize the egg. And these top images really are showing you during diestrus, or when she's not in heat. So this is a time period when everything's kind of quiet and you don't want anything entering the cervix into the uterus. And then this is what it looks like when she's pregnant. And that sucker is closed tight for business. It is really shut tight to protect that fetus and that young foal in there. Now, the cervix does differ a little bit in the jennies, and really the only difference is it's going to be a lot narrower, so it's not going to be as big as a mare, and it's a little bit longer. So if you're actually artificially inseminating a donkey, you may have to guide that pipette in a little bit longer. So just be aware of that their cervix does differ from the mares. Now, going into the uterus, which is just an amazing organ that, what it does, not only helping with sperm transport to get up into those oviducts, but also that it houses and nourishes an embryo and then a fetus. Well, in horses, it actually has a uterine body. So here you have your uterine body and then two uterine horns, so the left and the right horn. And where those break off is actually called the bifurcation, and there's an image of an endoscope exam where they've actually gone in and looked at that bifurcation. And when we get to pregnancy, we'll talk about this more, but this is really where a large embryo kind of gets stuck there, and then that's where it's going to implant. Now, horses do have two horns, so at some point in their evolution, they were probably made to carry twins, but twinning in horses and donkeys is very, very frowned upon because very, very few actually make it to term, meaning twins in horses is extremely rare that they actually survive gestation. So even though, a lot of horses can actually get pregnant with twins, and it's still less than, 20 to 10% depending on the breed, we don't want them to carry that to term. So we'll talk a little bit more of that during pregnancy, but their uterus isn't set up for carrying twins. Now, the uterus, again, as I've said, it's this incredible organ, so very important for sperm transport and then also for housing that early embryo and that fetus. And then this is just showing you, what it looks like. Here's what we call the uterine lumen. So that's actually where the fetus would grow and expand out with that. Now, during the phases of the estrus cycle, which we're going to get in a couple lectures, during the estrus period and the diestrus period, the uterus responds differently. And really that's hormones are dictating, how it responds. Now, when she's in heat, or the receptive period to the stallion, she's in this thing called, you'll see this thing called edema. So edema right here. And this is what her uterus will look like with an ultrasound exam. So what I like to tell students is, you know, it's like if you cut an orange in half, that's kind of what the orange slice would look, or we could say it looks like a wagon wheel. You know, it kind of has the spokes in there, and that's called edema. So that kind of lets us know with an ultrasound exam if she's ready to be bred, you know, among other things that we look at. And then during diestrus, you know, obviously that uterus changes because it's really waiting for an early embryo or for pregnancy. Now, we're going to talk a little bit more about this again later, but inflammation, like I've been talking about, that endometritis can lead up to buildup of fluid. So, you know, if during an ultrasound exam you look at the uterus and you see this, that's a cause for concern because normally they're not supposed to have fluid. They're supposed to look like this in the ultrasound exam. So this, you know, fluid would be a sign of some sort of infection, you know, what's going on in there, because that is not a proper environment to not only, you know, handle sperm, you know, or spermatozoa, but also an early embryo coming down that would get stuck in that fluid and it would end up dying. So that is kind of the enemy of reproduction, you know, for our equids. Any fluid in the uterus is a bad thing. All right, in this slide, what you're actually seeing is an ultrasound video of a research project I did here at the University of Florida with Dr. Lori Warren, our equine nutritionist, and then Dr. Dale Kelly. And what you're looking at is actually a postpartum mare. So this is a mare that had recently foaled. And so the uterus goes through this thing called involution, and it's amazing. Again, you know, you had this large foal in there. She kicks out the foal, and then within about 30 days, her uterus is going to come back to normal. And that's a period called involution. So what you're seeing in this image, or this video, is actually kind of an abnormal involution. This was a mare that had taken a really long time, and what you can see in there is the fluid buildup, which is actually a lot better than when she had been. And then you can see those endometrial glands that are pretty abnormal. So I show this video just to show you, you know, if you had ultrasound, say a mare that's not going through this period, but, you know, is a mare that you're trying to get pregnant and you see that on an ultrasound, I would be like, oh man, we've got some problems going on here. And you would have to diagnose that, you know, get a veterinarian in there to take some cultures or some other things that we're going to talk about. So that's kind of why I showed you this video, to see what's abnormal of the uterus. So some of your causes can be, you know, you can get a bacteria in there, some fungus or some yeast that actually gets in that nice warm environment and really flourish. And so then the body reacts with an inflammation reaction, the immune system kicks in, and that's where you're getting some of that fluid. Now, you'll also see changes to the endometrial lining, which could have long-term fertility consequences. So as that endometrium degrades, that mare's chances of, you know, maintaining pregnancy are get a lot slimmer. Now, how do you evaluate this? We already talked about the ultrasound. You can do things like a swab, a uterine swab in there, and culture that out to see if there's any type of you know, bacteria or other things in there. You can do a small, you know, uterine lavage, flush to sample the fluid, or you can do a uterine biopsy, and that's what you're seeing in this image here on the right, where, you know, a veterinarian or a trained technician can go in there and get a little snip of tissue. They mount that on a slide, and then they'll look at this endometrial lining to kind of evaluate what's going on. So if you have a mare that's, you know, or a Jenny that is really tough to breed, you definitely want to get a workup. I mean, you should get a breeding sinus exam on any brood mare that you either think about buying or you're having some trouble getting pregnant. All right, so that's enough time on the uterus. Now we'll just keep moving on in the reproductive tract. There is the oviducts, and it's broken down into three parts. You can see the isthmus, the ampulla, and then what we call the infundibulum, the portion near the ovary. The ampulla is really where fertilization takes place. So sperm cell meets oocyte, or the female egg, and that's where the miracle of life really starts beginning there. Now the ovaries is, again, a very, very critical organ that we use in breeding management to evaluate during breeding management. It really has two purposes. And the first is hormone production. So there are hormones produced, mainly estradiol. That's the one that the ovary produces quite a bit. And then progesterone, the other hormone it produces on the other stage stage of the cycle to help maintain early pregnancy in horses. And then also the oocytes, that's where they're housed, that's where they're released. So very, very important, you know, to the female horse or donkey. Now what's interesting about horses and what's unique is the ovary is what we almost consider turned inside out, where this tissue, where you can see, you know, say in the human ovary, this cortex here is actually interior to the horse, and then this medulla here is on the exterior. So really what that does is it limits horses to a single ovulation site, which we call the ovulation fossa. So unlike, you know, in humans we can do this, and in other livestock, cattle, a prime example, or pigs, where they actually can super ovulate, or they get more than one ovulation on an ovary. You know, we really can't do that in horses. Now there is some research, you know, coming from the United States and elsewhere in the world that is looking at super ovulating mares, but really biology is limiting them to really 1 to 2 ovulations per ovulation site per ovary. So really we're still very limited, where you can maybe get 20 embryos from a cow. You know, we're still looking at 3 or 4 embryos max from a mare. So that's it for the female, and as we go through the week, we're going to kind of build on that physiology. So some of it will start to make more sense if you're not too familiar with it. In our next lecture, we're going to talk a little bit about the boys. We got to cover them somewhat. You know, they are important. They are, you know, half of the process. So we'll jump into that, and I'll see you soon.